All right, I think we're going to get started. I'm Wen. I'm a volunteer with EWOC. I'm going to quickly just introduce what EWOC is and what we do, and then going to hand it off to Chris Brooks, who's going to be our moderator today. Thank you all so much for coming and joining. Really excited about this panel and really excited that everybody here was able to, come together so quickly to talk about something that's extremely timely. So EWOC was started in March of 2020 as a joint project between DSA and UE with the goal of helping workers organize during the pandemic. And since then, we've connected around 861 workers with volunteer organizers, put on six-week training sessions, trained about 1,290 people to organize their workplaces. And over the course of the last year, 2021, we welcomed around 450 new volunteer organizers. So along with that, we've created a slew of highly accessible online resources that you can find at workerorganizing.com or .org, is it .com? No, it's .com. And yeah, these are resources for people thinking about quitting their jobs, thinking about unionizing their workplaces. And yeah, so many of the workers that come through us, from baristas to grocery store workers, although not currently unionized, have definitely felt the brunt of the pandemic and the lack of proper health and safety guidelines. So I think everybody across all industries and in every workplace, union or not, will find today's panel extremely relevant and hopefully productive. So yeah, with that, I'm going to hand it off to Chris Brooks.
Thank you so much, Wen. Good evening, everyone. It's so great to see so many amazing folks from all across the country here tonight. I'm seeing folks from New York and Florida, San Francisco, Washington State, Louisville, Chicago, Minneapolis, so everywhere. That's awesome. We're really excited to have you. So I'm Chris Brooks. I'm the field director at the News Guild of New York, pronouns he, him. And I'm also a sustaining donor to EWOC. I love this organization. It's doing really incredible work. And I'm really grateful to be a part of the conversation that they're hosting here tonight. So this is a really serious topic. Obviously, the pandemic has just been absolutely devastating in our country and all across the world. Many of us have lost family and friends and coworkers to the virus, and we're literally in a fight for our lives. I can't imagine a more important conversation for us to be having in the labor movement. I'm really excited to dig into questions about how we can unite in our workplaces and across our industries and across our unions to build power for working people and to raise health and safety standards as we're thinking about moving into the next phase of the pandemic as we try to survive this phase that we're currently in. If you have questions throughout the presentation tonight, you can put them in the Q&A button down below, or you can also put them in the chat. We'll be monitoring that and we'll get to your questions later in the panel. So we're going to start off by just getting to know the folks that are here. So we're going to have the panelists tell us who they are, what union they're with, and what rank and file power means to them. So for me, it means overcoming the divisions that exist in our society and in our workplaces. We know that if workers and the working class were to unite together, we could take power today, we could take power tomorrow. So every organizing conversation we have is actually us shifting the balance of power on the job and in society. And that's what I love about these kinds of spaces that we're in right now, is that we're shifting the balance of power on a much bigger scale when we're talking across unions and across industries, across cities and across the country. So with that, I will turn it over to Gia.
Hey, everyone. Hope you're all doing well and are staying safe as much as possible. My name is Gia Lee, as Chris mentioned. I go by she, her. I'm a New York City public school teacher in District 1, that's Lower Manhattan, and also a member of the Movement of Rank and File Educators, currently a steering member. I'm also a member of the BLM at Schools NYC. So that question of what does rank and file power mean? To me, just, to add on to what Chris described, I would also say that it's really about gaining a handle as people, as humans, around racism, white supremacy, and how they appear in the workplace, how they appear in our communities, how they appear in policies that impact our work together and our lives together. And I think once we are able to see each other as humans. And through a very, like a panel of humanity and community, that's where we'll really gain our power together through our work and through, just our ability to have functioning and nurturing communities. So thanks for that.
Great. Jackson, do you want to go next?
So how do I define rank and file power? Is that it, Chris? Yeah.
Yeah, introduce yourself and how you identify rank and file power.
So Jackson Potter, I'm with the Chicago Teachers Union, the caucus of rank and file educators. And I would say, being able to understand mainly that there are friendly contradictions and antagonistic ones, and that workers, we have friendly ones, and that no matter kind of the cacophony of perspectives, where we're coming from, experiences, background, like when we're in a workplace together, it's us against the boss. And so kind of really developing that basis of unity, class unity.
Excellent, excellent. Thank you. Elizabeth?
Hi, everyone. My name is Elizabeth Wallish. I go by she, her. I am a registered nurse in Chicago. I am a medical surgical nurse, and I am with National Nurses United. I'm a union steward with them, and I work at Stroger Hospital, which is the safety net hospital in the city. And what does rank and file power mean to me? I was going to say something about it's really about I was going to say something funny. I was going to say or potentially humorous, is to scare the boss, so much so that they know that we are the people who they can't do anything without, and that but it's also for me about us as workers realizing we have that power. That if we don't work, they cannot do anything, and it's about unifying people along those lines. And it's true in this society, because as we see right now, as people aren't going into work, things are collapsing, like in healthcare. So power is about us realizing we're the ones that make society run. So that's what it means to me.
That's great, thank you. And Sean?
Hi, everyone. My name is Sean Petty. I work as a pediatric emergency room nurse at a public hospital in the Bronx, New York. I've been doing that for about 14 years. I was a board member of my union for 9 of those years. We led a rank and file takeover of our union 10 years ago. And there's many things to say about that and where things currently stand. What rank and file power means to me is, yes, essentially an ongoing process of putting into practice the idea that the boss needs us more than we need the boss. That goes for any sort of practical decision around our wages, around our working conditions, around who gets assigned to where, all the way up to how our entire economy is organized. So we are the ones that ultimately do the work. We know the work better than anyone that is in charge currently of overseeing and regulating our resources and profiting over our labor. And so it's really fundamentally about self-determination and a recognition by us that we are the center that everything else revolves around, and us, that realization turning into us acting that way.
It's great. I'm already hearing some common themes emerging around unity and power on the job and our relationships to one another and our relationships to our labor. So that's great. I think that's setting a great tone for the rest of the conversation. So I want to start out with just kind of like a really general question to give you a lot to respond to. This week, the United States, set a new national record, new global record for the number of individuals hospitalized due to COVID. We're seeing, you know, across the country, elective surgeries are being canceled in our hospitals. The National Guard, in many cases, in some cases, being deployed to help out. And teachers and nurses are both leaving their professions in droves, right? So there was a crisis in education and in healthcare, you know, previously, with being able to have the staffing that we need to adequately meet the demand that's out there. And we're seeing how that is just being impacted at such a deeper level now that the pandemic is happening, and infected workers are staying off the job, you know, and those staffing levels are getting even lower. So I wanted to hear from all of you about what this collapse of these institutions that you work for that are so crucial to society looks like. So can you talk about, you know, what it's been like on the ground, how you and your coworkers are responding to Omicron, and what actions you're taking in order to get through this moment? And we'll go in reverse order. So Sean, I'll start with you.
Sure. I mean, I think it's important to start by pointing out that we're facing an uphill battle against the dominant narrative that's happening right now in society around this particular crisis and this particular variant. There is an attempt by the entirety of the political establishment to normalize everybody getting infected by this variant, and to make it, to try to differentiate between the safety of the vaccinated and the safety of the unvaccinated, to try to basically get away with a two-pronged policy that has really been the two-pronged policy from the beginning, even from the Trump era, which is everybody should mask and everybody should get vaccinated. And outside of that, the responsibility of the people in power is relatively nil. And that's what they're trying to re-normalize. They're trying to normalize this massive spread of infection. So I think what part of our job is to, and this in a country, you know, with the most broken hospital and healthcare system in the industrialized world. So what our primary job is, I think right now, is to find ways to completely puncture that narrative by relaying what the impact of this entire pandemic has been. Our healthcare system was a disaster prior to this pandemic, and this pandemic has revealed and ripped the mask off how inadequate and deadly our lack of preparedness for this pandemic has been. So any attempt to normalize what's happening to people is an attempt to normalize a degree of illness and death and insecurity in people's lives that we haven't previously known. So we reject that, and it's up to us to relay those stories. So, you know, we're thankfully, since the pandemic, because, you know, Jackson spoke about contradictions earlier. You know, the contradiction is that they also, from the beginning of the pandemic, they relied on workers to keep this economy going. And so they had to laud us in a certain kind of a way. We were the heroes. We were the essential workers. They had to clap for us. They had to give us lip service, you know, in many ways for many professions for the first time. And now they're trying to walk back on that. They're trying to send us back to work. You know, in California, I just read, they're trying to send people back to work without even any quarantine period. If you're asymptomatic and don't have any symptoms, they can send you back to work right away and spread COVID among your coworkers and your patients. So they're trying to reimpose a degree of discipline on the workforce in this country right now to keep the profit motives going. So our job is to throw a wrench into that machine through our voices, our credibility, and if and where we can, through significant job actions. One of the things that we're doing tomorrow is we're having a press conference. It's the first press conference that's happened at a public hospital in this particular wave of the pandemic. We have a new mayor in New York City who is trying to present a very you know, I've got this under control kind of vibe. And we hope to directly challenge that narrative tomorrow with our public speak out and press conference. So, and hopefully that's only the beginning of some more significant actions to come.
That's great. And that press conference is at the Jacobi Medical Center in the Bronx, right?
Yep, I'll post the link.
Perfect. Thank you so much. So Gia, you know, so we're hearing about New York City hospitals. I believe that the direction that's been given in New York City schools as well is to come in and work sick, right? So similar situation. Do you want to describe what it's like there?
Sure. I don't know if folks are watching, but like Sean is saying, the rhetoric right now, the dominant narrative is that we have to learn to live with COVID, and that there's a sense of inevitability, right? It's not even a question of if, it's a question of when. Pretty much every single one of my colleagues at my school has tested positive, especially during that week before winter break and into winter break. Every day, someone else tests positive. So we, you know, in the movement of rank and file educators, you know, the caucus within the UFT, New York City's teachers union, which is the largest teachers union in the nation, you know, we were looking to our leadership to be like, hold on, you know, our buildings are not safe. Our students are not safe, thereby our staff and our families are not safe in our communities, the workers. So we were thinking that, you know, there would be maybe some kind of plan going into the first week back to school, which was last week. But what we got was something called Test to Stay Open, you know, and our new mayor, Eric Adams, came out on a press conference touting that, you know, it's something we're going to have to live with. And it's what's best for business because we can't afford to shut down. We can't afford to shut down again. So, you know, you brave workers, he uses my brave workers, right? You're going to go out there, you're going to do your job, and we're going to do our best. You know, we'll put measures in place. Don't worry, trust us. And unfortunately, there's a good segment of our communities that have put trust in that, but then also seeing the horror and the chaos ensuing. So currently, I just looked up the numbers for New York City. We have a 7-day average of over 32,000 positive cases. The 7-day daily average for hospitalizations is around 657 a day per day, and around 54 deaths per day in the last 7 days. That's unconscionable to me. And then New York City schools, this is New York State has a district by district kind of reported cases system. And in the last 14 days in our public schools, there have been about 89, almost 90,000 cases in the last 14 days. There were just over 13,000 new positive cases today. But, and I know that maybe other school districts around the country are maybe touting New York City's testing system in the schools. If you look at the total percentage, right, where they're not testing pre-K and kindergartners, and you have to have a consent form to get tested in the school. So parents have to fill it out. There's a really low percentage of consent forms citywide. It's all like based on schools, right? It's kind of like survival of the fittest. So schools that got organized and ramped up, the consent forms have a higher percentage. But then of that percentage, right, of people who filled in consent forms and sent it in, they were only testing 10% of those consenting. When this hit, they're like, guys, don't worry, we're going to up it to 20%. Okay. It was crazy because if you got one shot of the vaccine, if you're a student and you got one shot of the vaccine, they took you off the list to get tested. And I, as someone who's fully vaccinated, got COVID and got really sick. Like I still have something weird going on with my lungs. Coughing, I can't shake it, still getting extremely fatigued. And I can't imagine the little ones who are getting it and getting really sick. I just found out a student of mine has been in the hospital. We hadn't heard from them for 2 weeks and has been in the hospital, right? So of all those citywide, of those consenting, all that, the 20%, actually, if we were to test everyone, they've only tested 1.3% of people in the schools. That's not okay. That's not okay in such a big system. So we're in a system of nearly 1.1 million students and nearly 200,000 staff. It's spreading like crazy. And the situation in the schools right now is some families being like, we're not going remote, right? We don't want to go remote. You teachers better stop complaining, stay open. You'll get a little sick and get over it, right? Some kids will get it. It's not that bad. It's created this crazy, chaotic situation in a time when we could be galvanizing together and demanding from the city to provide relief for families, because it's happening already, right? Quarantining and isolating is already happening. Attendance rate right now is like 55%. So that means 45% of families are currently at home, and on a crazy like whack-a-mole situation where 1 week they go in, all of a sudden they're close contact, they have to quarantine for 10 days and get tested, PCR tested or whatever. And then it could happen again the next week after they get back. There's no system. So these kids are going without instruction, but the mayor is saying there's no remote option. Everybody, the schools are open. But the reality is very little instruction is happening because you can't really teach to half a class. You can't continue on with curriculum. You can't continue with any kind of like ongoing instruction. The inconsistency makes it impossible. On top of that, the trauma of all of this, right? And we're really finding that we need to organize with our families at the school level to build the raised consciousness, because these conflicts between parents that are being, basically manufactured between parents and educators right now, that has to get squashed. There has to be a lot of healing done right now and trust building, because we've been put in a position to be at each other's throats. So I'll stop right there because I know that Jackson has a lot more to say too.
Yes, we will move to Chicago, but we'll actually start with Elizabeth. Can you tell us what is it like in the hospitals in Chicago and specifically the hospital you work at?
Yeah, I mean, I agree with what Sean and Gia have said about this is really about a drive to normalize accepting COVID as part and parcel of our lives, whether you're in the hospitals, the schools, and anywhere, any workplace, in order to keep the economy going. And I think it's disconcerting because, so currently I'm on a COVID unit at my hospital, public sector hospital. This is my third time being on a COVID unit in the last 3 years. I also got COVID in March and April of 2020. And, like Gia, it sticks with you. And over the course of the last, I think what's disconcerting is I think people really thought things would be different by this point. Maybe that we wouldn't necessarily go back to what we were pre-pandemic, but that this would end. And we were told that the vaccines were going to be the thing that would help everyone and change everything. And, we'd be okay and just get boosted. And we just have to blow up that line at this point. Not that you shouldn't vax, but you should. But obviously there's a lot more that's going on here, particularly with Omicron. So being on the COVID unit at this point, I mean, it's really anxiety filled for everybody on there because most of our patients, I'll say currently, I was trying to get numbers. We're at about 20 to 23% in the city of Chicago, which is just, the patients just keep coming up. So I'm in medical surgical. I'm not in the ICUs where people are on vents, but our entire, like half of our ICU is filled. And our hospital is as big as multiple football fields. That's how big it is. So half of those ICUs, and people are vented. In my division, 4 out of the 9 units, I have the largest division in the hospital, are COVID units. it's disconcerting for us because we're vaccinated and some of us are boosted, and we've got, currently, I think the numbers are 50 to 60%, 50 to 60 of my coworkers are out with COVID. You can't work in the hospital unless you're vaccinated, at least. And so it's terrifying and anxiety feeling because you're working with patients who are sick and quite sick, but you don't know if, you're risking it again. And so all the things with the CDC and bringing people back. I had I had 3 coworkers who went out before we truly realized how bad this was. This was prior to my unit being converted over, which was, I came back from Christmas weekend. It was great. Hi, we're COVID. No notice, nothing from our hospital management to prepare us at all. But, I had 3 coworkers, all of who are in their mid-20s. One was pregnant, she got it. One tested negative repeatedly, but had it. So she won't get paid because she doesn't have a positive test. And one guy came back too soon. He got it. This is his 2nd time getting COVID. I mean, it just rips your heart out to see that. And you already have, prior to this wave, so many people leaving the profession. 1 in 4 healthcare workers have left. And we're talking about not just nurses, I'm talking about everybody. It's just like, I'm done, I'm retiring. We have a lot of travelers because people are making money doing that, which also speaks to problems within healthcare as an industry as a whole, because it destabilizes it. But, we just don't have enough nurses. We don't have enough doctors. We don't have enough social workers to actually be able to get home oxygen for the COVID patients to go home with because they need it, literally. We don't have enough ambulance personnel to take people home. Normally when, healthcare's got a certain rhythm and it's got chaos, but it really has structure to it because that's what you want. We don't have enough ambulance personnel to take people home on the day they're scheduled to go home. They may go home the next day or the day after. And maybe it's just crazy. And so it's been very unnerving in that sense. A new normal like this, as the healthcare system is obviously, to us, seeing it on the inside crumbling, means that, even if the surge goes down, then what? We will see the long-term outcome. We see COVID long hauler patients. It's devastating. Months and months and months spent on COVID ICU units, transferred to my unit, and then they can't walk. They can't breathe without supplemental oxygen. All those stories, but by this time, 3 years in, you're like, why is this still happening? And I think we need to give voice to it, like people were saying. And we need to, because the media is paying attention to a certain degree, but it's also like, I feel like we're screaming into a void. People aren't banging pots for us anymore. Although the damn banner about us being healthcare heroes is still up in the hospital and people don't believe it. So we're organizing, and I'm really happy that we have been doing this. I mean, we have a National Day of Action tomorrow in my union, and we're doing a local press conference. I'm going to be emceeing that along with other nurses. Really, we're taking on the CDC, the change in the guidelines. That is ridiculous. People are coming back sick. And then what? And so we'll have the press conference. I can put the link in the chat. But I feel like we have to give that kind of voice to all everything that's going on, and really tell people we were already on an edge, like Sean said. It was really bad in the hospitals. It is beyond bad. I don't even know how we're going to move it back. And I don't mean to be bleak about it, but that is how bad it is. And I think we need to begin to fight, and also not allow this to be normalized without us as working people, union members, non-union members, every industry, really fighting as much as we possibly can to change it. Because I certainly don't want to accept it. And I don't think anyone else here or anyone on the call or many, many people in this country and the world want to accept it either.
Elizabeth, I think you did such an incredible job of painting the picture for us of how our hospitals and before Sean and Gia as well, how our hospitals and schools are crumbling, and how amidst this devastation, workers are having to come together and like you were saying, forcefully to have a fight back, right? To paint a vision for what it is that it looks like to get on the other side of this. And I think that's why we were all so excited to see CTU once again leading the way, right? Like they have done so often for us in the last 2 decades. And I think, we're really all very eager, Jackson, to hear from you about, what the standoff between CTU and Mayor Lori Lightfoot has looked like, and what you all are doing to protect yourselves, your members, your families, your friends, and your students in this current surge.
Yeah, so, I'll give you a little background to help understand the trajectory of this current struggle and how it emerged. We had to threaten a work stoppage, in March 2020, because Lightfoot wanted to keep schools open. It was clear she's trying to punish teachers from our 11-day strike in October 2019. She was an impossible person to negotiate with. And I'd say we missed Rahm Emanuel. That's how bad it was, because you couldn't have basic conversations on common sense issues. She was so mercurial. And it required our governor in Illinois to close the schools at the state level. Otherwise, we were going to walk out. That's what it was going to have to happen. And that détente continued until the beginning of 2021, and we remained remote. And because of our popular support, our density, Lightfoot realized it'd be easier if she divided our membership into sections and brought back people in waves, pre-K cluster, elementary, and so on and so forth. And we had to really try to, get ready for that. It was over the Christmas break where this started, when people are in hibernation mode, and quickly members began to refuse unsafe reentry. They risked their jobs. They got disciplined, threatened. We had a sick out with 1,000 members leaving work under threats of discipline. And after months of struggle, we were able to secure a safety agreement with school closing metrics that had our school safety committees established and could, do things like establish ventilation requirements for the district, social distancing, et cetera. And then summer and fall of 21 came about. And this goes to what others have said on the panel. Lori Lightfoot essentially refused to reinstate any safety agreements. She claimed, we have Biden money, we have slowing rates of COVID, so it didn't necessitate the same metrics previously. And that was essentially the national line for the Democratic Party. But in our local situation, it was done with bitterness and inflexibility and a vengeance. And so this all is sort of in a tug of war until Omicron emerges. And a really powerful and disorienting whirlwind of democracy really takes root and comes out of our union. We don't hear about Omicron until late November, and it's the same time that members are ordinarily in survival mode ahead of the 2-week Christmas break. And so as the variant spread, it became obvious we needed to press to reinstate our safety agreements and our MOUs to enhance the mitigations at the school level. I'll give you an example of why that was needed. Many of my students come to school and they're given cloth masks issued by the district. Well, Omicron, if they were insufficient before, they were completely useless after. And we had no sort of effort by the district to change that, even though that's what the CDC recommended everything. They were ignoring those suggestions. And my classes and school went from 2 cases that were identified the week before Christmas break to 40 cases last week. So this was happening all over the district, and we didn't have these basic measures in place to protect us. And so members went from being, terrified to being enraged, in part because there was a testing debacle where the district sent home 160,000 take-home tests for students to take over the break that would purportedly put them in the COVID isolation category if they tested positive, But the problem was they were only able to process 10,000 of those 160,000 tests. So they, did for the first time actually offer tests in great quantity, but then they botched the entire delivery system. And it was a big scandal on the front pages of the newspaper. And at that point, our members said, there was this overwhelming sentiment that flooded during the break that we needed to do something. And we held a couple membership meetings. And at that point, that's when it just was clear we had to do something. And that's when the walkout materialized and a resolution was passed when we came back to school and talked to our members last week. And this was a really tough period because we've never had to, think of a contract campaign where you have structured tests for a 6-month period. And in this situation, we had, 2 weeks, and it was all virtual until, the Monday and Tuesday of last week. And so we didn't really have time to evaluate our adversary and sort of what the consequences might be if she locked us out for 8 days without pay, and get a clear sense of where people are at with that decision. Just the sentiment was Omicron was coming, we better do something. And so, we're the only teachers union in the country that did that. And we didn't get like the gold standard that LA got in terms of mitigation and having opt-out testing, like Gia was talking about, which we want as well, and New York wants, so that all students are getting tested. But, even LA's got 18,000 outbreaks the last week. So these things aren't nearly sufficient even when they're good. It's like there's no victories in the COVID era. And I'll just give you one last example, and then we should keep talking. The Illinois Department of Public Health shows that 40% of all virus spread occurs in schools. Well, that's misleading, and it's because they only contact trace mainly in schools. So of 2.4 million cases of COVID, they only figured out where they started in 15,000 of those 2.4 million cases. So our relative power as workers, as teachers, is helping us be able to surface how much of a problem it is. But that's only because it's not happening anywhere else, right? It's not happening in restaurants, in sports stadiums, it's these other places where people have to work. And so really, we're going to have to start thinking about how do we leverage our collective power across sectors? Because, I think Gia was talking about it in terms of pitting parents and teachers against each other and even students. That's increasingly happening, because we can shut down schools. We're one of the few worker groups that can do that, but that is not sustainable. So I look forward to talking more about how we can collectivize this struggle and resistance.
Oh, that's incredible. Yeah, I have to think that like part of CTU's ability to respond so quickly is a direct reflection of the years of commitment to rank and file democracy and to being a fighting militant union on behalf of the schools that our students deserve. Unfortunately, not everybody is in that situation of being a part of a union that's like that. I think it's probably fair to say that the UFT is not. And so I'm wondering, Gia, like for someone who's in like a situation like you're in, where they're part maybe of a dissident caucus or a network of teachers who recognize that they have power, but they don't see their union leveraging it. What can they do? Like what has MORE done in order to push from below to get its union to try to take the steps that it needs in order to protect school workers and students?
Yeah, well, one, caucuses like ours have to create a space, like the space, right? In the absence of real leadership, like in Chicago and, in LA, we have to create the space. And once we do that, like in March 2020, when we did that, and we saw that at that time, Mayor Bill de Blasio was not going to be shutting down the schools, we held an emergency Zoom meeting. And at that time, we're a little caucus. We have like the regular Zoom package, right? We don't have the webinar feature. We don't have like 500 capacity. We hit such a ceiling, and we hit 500. And then we're like, oh my God, more people are emailing saying they want to get in. It exploded. And then there was like word got out that there was a potential sick out about to happen. What happened that Monday? Schools got shut down, right? And this is in the absence of the leadership. Now, did the leadership come out and say like, we did that and take credit for it? Yes, they did, but that's okay. The point of it was that we needed to keep people safe. And then going along, every time there was a situation like coming into school last year too, we had to hold another emergency meeting, knowing everything was getting built while the plane was flying in the air. So constantly having to fight together and organize. We started developing like more district because we're such a massive school district. I think LA is around the size of Brooklyn, for example, in terms of like numbers. So we just started working with our base, doing a lot of organizer trainings, like those secrets of a successful labor, the labor note secrets trainings. Some of us got trained to give those. We started putting those out, trying to build leaders up in schools to work with their chapter. Okay, you're good. You guys are getting a little chapter going. Now let's try to help our district, right? There's like 32 districts in New York City. Trying to organize this massive system feels really unyieldy at times. And the politics in New York City is, you got to do the analysis. Like, why are some people afraid or completely obstinate or whatever? But up in the last couple of weeks, the last few weeks, actually, when Omicron hit, all that work since that like March 2020 time of cultivating and like really bringing up leaders within the caucus, it was almost as if things were like kicked into high gear then. And instead of like more centrally organized, like small group of people doing things were happening all over the city. Like the District 15 in Brooklyn organized a huge protest in front of Barclays Center that got a huge amount of press. During the first week back, there were stakeouts happening. There were pickets happening, color days happening. It was kind of like created a space and we said, hey, look, let's brainstorm together all the possible actions schools could be doing, even if you are not the chapter leader, but you happen to be organically a leader. How can you find other people? And chapters are reporting back that they had, for the first time, everyone wore Black all week. Even that was like a huge deal. It's like planting the seeds for greater organizing going on. Yes, last night, 2 nights ago, sorry, we organized a big protest outside our union office. And that's not something that, anyone wants to do, but we've been begging and pleading our union leadership to listen to us when we're saying we are struggling. We are on the brink of a complete meltdown. We need your leadership. They did not come downstairs. In fact, they went off on Twitter and gaslit us, saying, your boss is down the street. Why don't you go protest in front of their offices? And people responded and dragged the union leadership, saying, those are your members crying out for leadership, and you're putting more energy into bashing them than the mayor right now. So the backlash against that is enraging, right? The rank and file right now. It's igniting a fire in the rank and file to be like, we have to be the union. We're the union. Can't wait for anyone to come save us right now. And it's like little sparks happening everywhere. We're getting reports, like we're having regular action roll calls. They're happening at least 2, sometimes 3 times a week. And we're hearing from all like people we've never met before across the city. It's really, really exciting.
I know it's already been mentioned several times by now, but the failure of the CDC, the failure of the federal government to take effective action in this moment, it's pretty clear that we can't rely on the Biden administration. They're trying to tell us just to live with it, that the pandemic is endemic. So what we're seeing is clear policy choices that prioritize the interests of the billionaires, corporations, Wall Street over public health. And some of our union leaders, right, are making the calculated choice to accommodate with what the Democrats want, rather than to create a political vision for an alternative. So I just want to put that out there a little bit. It's this question of like, how do we develop that political vision among ourselves, like across our unions, for what it is that we're fighting for, and unite people behind it. it seems like we have to aspire to more in this moment, right? So I just want to, that's a big general question, but I just want to put it out to the group again. And Sean, I'll kick it to you to start off. Oh, you're muted.
Yeah, so thanks, Chris. Yeah, I think that's why, at a certain key point, once you move past a certain degree of organizing from a rank and file perspective, it ultimately raises all kinds of very important political realizations and political questions, and leads very organically into a series of the political demands. I think, the way in which you see the nature of union leaderships have to wrestle with their relationship with the Democratic Party. Far too many of them are not wrestling with that relationship. They're perfectly comfortable with that relationship. And because there's so many steps removed from the conditions on the shop floor, from the conditions in the hospitals, from the conditions in the schools, that it's a much easier decision for them to make. But I think that is why you always have to bring it home to organizing in a way that organizing like the union you want your union to be, and organizing in a way, and even if you don't have a union, organizing in a way that you want your future union to be. And I think the question of how you then begin to articulate and put forth these connections, I think always has to run through what you do, how you communicate these issues with your coworkers, how you communicate these issues when you do actions publicly. You always, you tie one hand behind your back when you only leave it at the much more narrow questions of the particular struggle, or maybe the one issue that maybe started off this organizing or started off this round. I mean, hearing Gia and other folks talk, I'm just like, it just reminds me that the ebb and flow of organizing. I mean, sometimes especially when you first get into organizing, you think, okay, yeah, all I have to do is just get people together and everybody's going to realize that this is the, no, it's a lot of it's about setting the groundwork and playing a long-term game so that you're prepared when these flashpoints happen, right? And these flashpoints aren't going to happen all the time. These flashpoints obviously happened for many of us big time after the first wave of the pandemic, and the lockdowns began. There is another flashpoint happening right now. And especially with the dynamics of what they're now calling the Great Resignation or the Big Quit, where there's a massive labor shortage. People have the ability for a very temporary amount of time to economically survive without working in certain ways. We have a tremendous amount of leverage to help organize and make serious demands in this potential for a flashpoint. It's not going to look the same everywhere, but in certain places we can help sort of kick off a series of actions that I think can have a cascading effect in this moment. And I think the relationship between the backlash that's going to happen, it was a little bit, and it was more difficult under Trump in a lot of ways, mainly because he was so insane, and so he demobilized people with his obstinance. And at the beginning of the Trump presidency, there was a massive amount of mobilization, there was a massive amount of resistance, but that died away as Trump sort of consolidated. It's more challenging now in some ways because there's the pretense of a more sane person in charge. But when you actually look at the substance of what's actually happening, it's actually, especially with COVID policy, it's more continuation than it is departure from the Trump administration. There's a lot more consistent rhetoric. There's a lot more a more highly developed sense of people being in control. But if you look at the core of the policies and the core of what they're directing the CDC and they're directing the narrative to become, it's very much still centered on corporate profits. And so, but the difference, I think, and this is the last thing I'll say, the difference is that people have gone through this last 2 years. People have seen Elon Musk, people have seen Jeff Bezos make hundreds of billions of dollars during a pandemic when people have been locked down and people have been barely scraping by. Taxing the rich had a big victory in New York State last legislative session, but it was still only a small portion of what we even could have won. So there's a growing awareness of this profound degree of tax evasion by the richest 0.001% and the amount of resources that sit at the top of this society and the amount of need that there is, amongst us. And I think that their consciousness right now amongst people is really ripe for a kind of explosive element within organizing that I think does harken back. And I'm glad we're on an EWOC panel because EWOC was born in that moment of needing to try to figure out how to take advantage of that initial moment after the first wave of COVID to try to provide organizing support for that first, major wave of opportunity for that organizing. I think we're reaching a moment for that right now. That's certainly true, I think, in hospitals where nurses are just, they're either quitting or moving to another hospital, but there's a core within that who are like, you know what, because I'm about to be out of here anyway, I might as well fight like hell, and I might as well, just, I don't have anything left to lose. And so there's that bubbling of anger that can turn into action if directed in the right way.
Yeah, it seems important to note that EWOC was created by the UE and DSA coming together, right? Not by the Democrats, for good reason, right? It takes vision, it takes organization, it takes a commitment to these kinds of principles and values and to an analysis of society in order to create something like this. So Elizabeth, do you want to add to that?
Yeah, I mean, I was going to say, over the last 3 years, there's been ebbs and flows, and it's been very, there've been periods of a lot of explosive fight back. I remember in the beginning of the pandemic, I remember looking to New York and seeing, Sean was on the front of one of the New York papers because they wouldn't give them anything other than surgical masks, right? And it was outrageous in the ER. And what we needed was N95s. We had a similar fight here as well. In Chicago, it wasn't on the news, but inside the hospitals, my chief steward in the ER was doing mini sit-down strikes in the break room, demanding N95s and saying we need to get them from management, and we got them, right? But I think through the period post-Trump, it's been quite quiet, right? And people have been vaxxed. We're going into getting boosted. We think we're kind of okay. And it's all the stuff about all of a sudden, Omicron comes, we had Delta, but this is really hitting hard. And then you literally have the promises that were given to us by the Biden administration of, yes, they're abiding by science, but they're also abiding by the demands of the capitalist, economy, right? To stay open. And that inherently means we all have to go to work. Teachers because of, kids and working parents and, obviously hospitals because of the sick. And so right now, I think is an opportunity because people are seeing what's happened. My coworkers are like, what just happened with the CDC? Why is it that we're actually seeing a rollback? Why do we have to fight management so hard for some PPE that we thought we were guaranteed and fought very hard for? So it is about understanding, I think, right now. And I think that's what in discussions, and I've been involved in solidarity work with the CTU over the last week or so, is really that we can't rely, and what people are saying is we can't rely on anybody else but ourselves. Nobody's here to save us except us. And so that idea in your union is really about, when we talk about what the icebreaker question was about, what is rank and file power, this is what we're getting to, right? It's coming back to the fights, within our workplaces around particular demands, but it's also about talking to people politically about, why is this happening right now? And why do we have to bear the brunt of it? And then what do we need to do about it, right? And I also think it's about building solidarity. I mean, I've been really anxious because I remember how much healthcare unions fought in the beginning. And I'm like, where are we? Where are we? We need to be out there doing this. And so I'm really thankful that the CTU did what it did. And I know that they stood alone in many respects in this country. And it was an incredibly important thing that we have to take lessons from about what it means to fight in this moment. So, one of the things I think is important is really building solidarity with that. I know we did a small thing through my union and did a joint press conference with healthcare workers here in Chicago with us, my union, the Illinois Nurses Association, and the CTU about why we needed to actually support CTU or our hospitals would collapse. That's right. Like 20 to 23% positivity. And we're not talking about, and when we talk about capacity, it's capacity of humans, not of beds, not of ventilators anymore. It's about human beings not being there. And again, comes back to what I said in the beginning. We're the ones who actually, make the society run. And the fact that we're not there is putting such a strain on people. So that solidarity, I think, is also part of envisioning what kind of union we want to build, right? It's both about the immediate demands and us being the people fighting for it, but also how do you link with other people in other unions, and also seeing the commonality that we're not the only ones going through this, and continuing to build those links wherever people are fighting, whether they're unionized or not unionized. And I think that's what, EWOC speaks to too, is the need. There's so many people who want a union, so many people who see that they need a protection, and find protection in that sort of collective action. And, I think that's what we have to keep pushing as a vision for our union. So.
That's great. Yeah, in the News Guild, we often been saying that our greatest protection is each other. We can't look outside of ourselves, right? We have to have each other's back. And I know a lot of what we've been talking about too is like the need for collective action on the job as a major source of the power that we have. It's not just the ballot box. It's definitely not just voting in Democrats and hoping for the best. And so collective action also comes sometimes with the potential for the employers to try to divide us further, right? By pitting, nurses who are striking against patients, right? Who you're ultimately fighting for, and teachers against parents. So, Jackson, I'm wondering if you can talk a little bit about, how we raise expectations, how we fight for these bigger demands, but also are capable of pushing through it in a way that doesn't allow the employer to divide us, right, from the community support that we often need in order to win the demands that ultimately are going to benefit everyone.
So I first wanted to mention and give credit where credit's due that many of our folks on the ground were watching MORE and your struggle in New York. And that served as an inspiration for us during the holiday break and energized people to think through this strategy of taking action and doing that walkout, the remote work action. And so we're going to continue to need to innovate, steal each other's strategies. I just posted the student walkout, connecting with broader constituencies. So we're not just like doing it ourselves and trying these, general work stoppages that can anger various constituencies, but like really strategizing across sectors and across different constituencies, because we need to show we're not special snowflakes, right? Like teachers can't be the only workers having some protection at work. And so it's important to generalize that resistance. And I think there's like no great choices either for nurses or teachers in terms of labor actions. Like they're both problematic if we decide to withhold labor in order to improve safety, or if we decide to go back. Like both of them have these really gut-wrenching implications, especially in terms of the racial disparities exacerbated by COVID. So 2 times the number of Black people and 3 times the number of Latinx people have died of COVID compared to white people. and they're more vulnerable, less access to healthcare, vaccine hesitancy from racist medical malpractice, lack of access, and more economically vulnerable, which makes it harder for them to find childcare if we're not working. So, or find healthcare if we're not working and you're a nurse. So we need the schools to play this vital function, but we also can't allow them to harm the communities they're designed to help. And we know that Black and Latinx students are also having expanded suicide rates during the COVID era, and remote learning doesn't help that either. And I think we need honest conversations about that without demonizing remote teaching, which we're going to need during this period and have needed. So how can we create chokehold demands? Like, imagine if nurses and teachers walked out together with parent community support, then you might actually get Biden to use the Defense Production Act to produce sufficient masks, because there's a crisis and his numbers are already in the toilet and he can't run the schools or the hospitals during a public health crisis. We might be able to force him to give other countries our Moderna recipe, adopt Medicare for all for once as a platform issue that's, especially necessary now. And I think that makes our ability to win much greater if we can do that cross-sector coordination, because, they have supply chain issues when it comes to life-saving resources, but Amazon's making record profits. So, we have to generalize struggles so that the workers that don't have the moral and contractual power that teachers and nurses have an opportunity to participate in something more generalized. And I think when we get there, start attacking the pharmaceutical companies that are charging so much for these, rapid tests. Start, calling for that to be manufactured here by workers, by city governments, whatever. I think there's lots of different applications here.
That's an exciting idea. So I want to move to some questions from the audience that have been sent our way. And so Gia, this one is for you. So we have a question from a classified staff member in a high school, and they said it's been challenging to bring together teachers and classified school personnel and school nurses to all work together in the face of Omicron. So how have you all been bridging the gap between different job classifications in schools?
So, one thing is this work requires a lot of relationship building and trust. And it's something that I've been, as the chapter leader at my school, some people, it's like you're the union rep for your building or not. Developing relationships and just literally listening to what the main issues are for those different folks in different job titles, sometimes even different unions within the same school. I talked to a lot of people in my building. Like, there are 2 other schools in my building, and we are trying to develop a more building-wide organization. But really, once we start developing those relationships, I invite them to a meeting, right? Invite them to a meeting to talk about these issues and say, like, it's going to be a lot harder if we try to fight on our issues on our own. What if we got together? And literally, like, our parent coordinators in our school, they're alone, right? Nurses are part of our union, but they seem to always be kind of like, they don't have a lot of relationships with some of the teachers, or they just like in the office by themselves. So developing those relationships, I find like really important. And then when it comes time to talk about issues, there's a trust there. And then creating the space in the meeting to be like, we're going to hear from everyone, but we're only going to take a couple minutes, and having ground rules, right? Your norms for the meeting, because not everybody's familiar with that. I've been told that created such a safe space. People who were afraid to speak up or complain or like not trusting each other, like once we set the norms, people were like, all right, I've never spoken up at a union meeting before, but I feel like I'm going to do it. So like over time we've had that. So we've been able to like have a list of our gripes, and then we get to like, so what are our demands? What do we want? And what are we willing to do together? Let's create a campaign. Let's create a plan. And it's not all perfect. It doesn't work out like a linear, like, yay, there's bumps, there's tensions, they come up, and it's like repairing relationships sometimes with people. But yeah, it's constant work, but it's so amazingly powerful when you realize like we're getting together and we're going to do shit. that's going to change the conditions for us and make it better. And that's what gets everybody to even want to like fix, bad tensions even. So yeah. Norms, I just saw the question in the chat, like meeting rules, like how, keeping a stack. You have to, speak to the issue, not at the person. Agree to disagree on certain things, just like norms processes.
So yeah, Jay, I'm really struck as an organizer, one thing I'm always thinking about is that organizing conversations are actually a stepping stone to bringing people together as a group, right? Building relationships so we can come together as a larger group to plan and identify problems and target our decision makers and come up with our own solutions. So that sounds right to me. Another question that's come up is, and this has been a theme in our discussions, is like so much of the dominant narrative right now is like live with it, deal with it, go to work. It seems like that's the message that's coming from our employers. That's the message that's coming from the political leaders in our country. So we're really pushing against this really powerful stream that's hitting us. So folks are asking, how do we overcome that? How do we overcome the feeling that people are just going to cave? Like we just have to muddle through it. And how do we also overcome, potentially our own union leadership thinking that that there's nothing that can be done at this point, that, the writing's on the wall. So Elizabeth, I'll kick that to you.
I mean, that's a really good question, and one that I know I've been thinking about because it's really difficult right now, 3 years in, and people trying to actually mobilize and figure out how we can move forward, right? And it goes back to the idea of what Sean was saying, it comes in waves, right? We went on strike in the summer of last year, which built on all of the mobilization we had done around fighting for safety prior months. And, I think people sort of thought, okay, this is done, we're over with, and we're good, right? We got money, we got the staffing or guarantees of staffing, and I think it got very quiet. So that's kind of where things are at, come the summer of last year going into the fall. And then obviously, things started to get much, much worse inside the hospital. And the staffing is just, it's really abysmal in that sense. And so I guess to the question about how do we keep, getting people to mobilize, how do we also push our unions to be active, like the leadership to be active is, we found issues, and some of it was very small to begin with. It was money, I'll tell you. And people were complaining, nobody's doing anything. And we lost a lot of people too. Like we lost our chief steward. She just couldn't take it anymore. She left, and she was amazing during the strike. And so we had to, we're in a process of rebuilding that stuff. But it was like, we took on the issue of us not getting paid for our contract. And then it mobilized people, and we began to see that there were other issues as well, staffing and right now retention, and it's kind of a snowball effect. And we've been pushing on our union leaderships, even though my union is open to a lot of things and a lot of demands and has fought the entire time. But we also began to talk about what we needed inside. And it's not an easy thing, but honestly, I think if you mobilize inside amongst your coworkers, your union they start to pay attention to it. And they start to push on that. Like what Gia said, they take credit for things that they never even organized, but they're also, they want to actually, how do you say it? They don't want you to do that without them, but that is the inherent, role of rank and file, is to actually press the union leadership to actually respond. I don't know. I guess I'm trying to grapple with that question as well, about how to move both through these waves when, things go up and down, and it's been very exhausting, and getting people mobilized. But also, how do you, not just accept the quiet coming from the top as being, when people are suffering, how to push them into activity. And I think that's about, taking the issues and building on whatever that issue is, and right now, or the multiple issues, and it, you know, and begin to really push your leadership or your staffers to really take that up seriously. So.
Does anyone else on the panel want to respond to that? Take a swing at it.
I'll take a swing.
Help me out.
Well, I mean, well, it's really interesting because it's like, on one hand, we're talking about something that's really important with organizing, which Gia emphasized, which is the trust element, the cohesion building element, the interpersonal element, and the one-on-one organizing element, which which can't be underestimated. And certainly in today's world is sort of like, you know, we now have sections of the left and sections of the labor movement, you know, using tech consultants to try to substitute apps for organizing, and a whole trend within organizing that basically, you know, tries to skip over the very hard, you know, element of organizing, which is convincing somebody to prioritize another thing in an already very difficult life, which is to take time out of your schedule and prioritize, you know, helping to build unity among your coworkers, or helping to build unity in a political struggle. So that's a very difficult thing, and there's no amount of communication strategies that are going to substitute for that one-on-one organizing. And then on the other hand, you have Jackson talking about nationwide coordination between two of the largest sectors of workers in the country, you know, to need teachers and nurses in this grand, you know, the scale of necessity of organizing that this moment poses to us, right? These are things that are possible if these forces go into motion. So I'm trying to figure out a way to sort of figure out where these kind of different, you know, different strategic methods sort of meet. And, you know, I think one of the things that I learned very early is that nothing's a better educator than the fight itself. So once people are able to move into motion, ideas and realizations happen much more quickly than just through conversations alone. The risk and that people take, the amount that people pay attention, you know, just thinking about the CTU action over the last week. I mean, there's nothing that you know, the two things in national news were the Omicron crisis and whether or not Chicago kids are going to go back to school. And, you know, Stacey Davis Gates and Jesse Sharkey were, you know, commenting right next to Biden, you know, around different issues of national import. So like, there's nothing that does generate that kind of attention and that kind of ability to shape the narrative like those militant actions. But it's true that we're still very small as rank and file coordinating forces, and we're still very in piecemeal places. So there has to be a combination of people organizing very actions that I don't think we thought would have been possible 2 or 3 years ago that are now possible. Like you know, one of the things that I think of, and Jackson poses the question very shortly, like it's very difficult to organize a strike in a public hospital during a pandemic, right? You can't shut down, you know, 1,000 hospital beds, you know, during a crisis. So, but what you could do, and this you know, shares something with education, which is one of the ways that they've profoundly distorted healthcare and education is making them both data driven. And they rely on data. They rely on so much data. They rely on data for billing. They rely on data for labor metrics and productivity. And they do the same with students, and they do the same with teachers. And so there's might be ways to organize perhaps like a national data strike, you know, picking and choosing and coordinating what are the forms of data that we all participate in and are required to participate in that don't have any bearing on the actual things we do as teachers and nurses, which is, teach and give healthcare. They only have bearing on how our labor is tracked and how the money that gets produced from our labor gets tracked. So, there might be some ways in which we could throw wrenches in the system that don't fundamentally compromise some of the actual services that we provide, and help freak out our bosses and gain a spotlight, but also build kind of solid, continue to help build solidarity. But I think that, whatever, CTU has given us a great model of how to build. I mean, the amount of parent support, even in this difficult time, and I know that it's been, even a greater challenge in this particular moment than it has been in previous moments. But the groundwork that CTU did in building the credibility amongst their struggle with parents is 100% a model in terms of how you have to build the kind of struggles, especially in the public sector, especially when we're delivering these critical services for communities. And I think there's many. It can't be just a narrow. It can't just be a narrow fight of just the conditions of the workplace. It has to be a community-wide fight, and you have to organize and prepare for that in that kind of a way. So that needs to be repeated and emphasized. But I do think there is a possible way to possibly coordinate some easy to replicate actions that can help build a kind of national coordinating mechanism that we can start to build on, because I think these next couple of years are going to be serious. Like all of the stimulus money that has been pumped into this economy that has kept it afloat is going to dry up. And all of us are going to fall off a massive financial budgetary cliff at the federal, state, and local levels in the next 2 years. And we have a little bit of a reprieve, and Gia and Jackson and Elizabeth can feel this. There's more money in our system now. So, it's easier for them to hire people. It's not fixing the problems in our hospital because of the crisis that has existed, but there is technically at this very moment more money in our system to fight for. But that money is not going to exist in 2 years. So there's going to be a real critical point that we have to prepare for. And I think this is the year to do it.
We're getting close to the end here. I did want to ask one final question, and Gia, I'll send this one to you. So obviously, like we've talked a little bit tonight already about how the pandemic has been disproportionately impacting people of color, communities of color, immigrants. So how are you, and how is MORE like having your anti-racist commitments informed and infused in the battles that you're fighting in the workplace right now? What does that look like? How are you doing it?
Well, one, it is like speaking back at the rhetoric that of the inevitability of everyone getting this virus, and saying, are we okay with that? Who's most disproportionately going to be impacted by this virus, right? Sean's alluded to it, Elizabeth, like everyone has basically talked about how, disproportionate this has been. Access to, adequate healthcare. Who has that? Who doesn't? So that conversation is happening. Like, we don't want people to get sick because, hey, everyone's going to get it, and it's, what we got to live with. And so we're saying, no, that's not a choice, that we are making for ourselves. You don't get to make that decision for us. I'm an elementary school teacher. We have our little ones who don't have access to vaccines, right? Yet they're being thrown into the building. Those parents are keeping their kids home. We had a community call the other night. A mom came on and said, my older child struggled in remote learning. It was awful. I couldn't wait for her to get back to in person. But and then she broke down. I have a 7-month-old with a congenital heart condition, and then she couldn't finish her sentence. She's like, I cannot afford to catch this or for my baby to get this. So having these conversations, I think, it's really important to talk about disproportionate impact and to also bring in like the people, right? To be like, no, you'll often can tell when you're at a PTA meeting who the parents are that are like, no remote, right? And then the parents who are very silent in the meeting because they feel like they've been silenced and feel like, I'm just going to keep my kid home then, because that's how you all feel. You don't care about us. And the us are typically the Black and people of color. And one other thing I just wanted to share is that when we go out, every single action, the students come out. They came out at every single one of our actions. It inspired them to organize their own walkouts yesterday. They came and said, can I speak on the mic and talk about our action tomorrow and tell other students to come out? I was like, yes. We supported them. And the parents, all the parent orgs came out. They feel like we're their only allies right now in this.
That's great. So I really appreciate all of you on the panel here tonight for sharing your stories with us, this really sharp analysis you have about our current moment. I think that one of the themes that emerged and that I think is definitively true is that we're all in this together, right? And really raising health and safety standards for workers in this country is going to require all of us throwing down in our workplaces, right? It's going to require all of us recognizing that if business as usual is allowed to continue, it has a huge impact on hospitals and schools, obviously. So the ability of restaurant workers to organize, the ability of journalists, like in my union, the ability of service workers at Amazon, like warehouse workers, everyone everywhere has a direct impact on everyone else. And so, if you need help and resources, obviously that is why EWOC is here, is to help workers everywhere learn how to organize, to have the resources available to them to be able to accomplish that. I'm grateful for EWOC. I'm a sustaining donor for that reason. So, this is what it looks like for us to continue to build power in our unions and across industries by having these kinds of conversations, learning from each other, leaning on each other, and building that solidarity. So I appreciate everyone on the panel. I appreciate everybody for listening. And with that, I'll turn it over to Wynn to lead us out.
So hard to follow up from that. This is such an amazing panel. Thank you so much, everybody, for joining. I can't believe like over 100 people stayed the whole time. That's really crazy. But I just dropped the link to talk to an organizer. If you're interested in organizing your workplace to build power and raise health and safety standards or beyond that, just workerorganizing.org/support. And also, like Chris said, we would absolutely love it if you became a sustaining donor of EWOC so we can keep up the work that we do. We're all volunteer run. We have 2 staffers, and even $3 a month makes a really, really, really big difference. I'll post the link in here. Thank you so much, everybody. I'm sorry I don't have music to lead us out, but I hope everyone has a good night and stay safe out there.